The world rallied to fight HIV, TB, and malaria with tremendous success. Deaths from these conditions are finally in decline, but the lack of investment in health system strengthening, workforce, and infrastructure have left these health systems fragile and unable to adapt to unforeseen crises. Almost half of the Earth's population lives without the safety net of a functioning health system. These individuals' lives can be shattered were they to be so unlucky as to experience trauma, obstructed labor, cleft lip and palate, clubfoot, cancer, hernia, or cataracts. Millions are still dying due to a lack of access to surgical, obstetric, trauma, and anesthesia care, which we have termed the neglected surgical conditions. This issue cannot be solved by one person, organization, or country alone. This requires a global effort. Did you know that nurses and midwives provide more than 80% of healthcare worldwide? They will play a critical role in increasing access to surgical care. Nurses are already doing so in Mozambique, Tanzania, and Nepal, and it's increasingly important to scale up our efforts across the world. How can we ensure that nurses and midwives and clinical officers, the future of safe surgery, get the training, mentorship, support, and skills they need? How can technology make surgical care safer, easier to access, and closer to where people live? What new guidelines and policies are needed to empower nurses, midwives, and clinical officers to perform essential surgeries and provide anesthesia care? Who do we need to persuade that the cost of inaction is too great? Now is the time for advocacy, for innovation, for action. 5 billion people are counting on us.